Hey guys, it's Dr. Akiba Green here. I'm going to talk about something that I use every day in my practice and in my personal life. Turmeric. Now, there's 3 reasons to eat turmeric. You know, it's a spice. It's been around for centuries. It's used in Indian curries. It's even the reason mustard is yellow. More importantly, evidence is accumulating that this sometimes messy cousin of ginger can help prevent diseases and even slow the aging process, probably due to its largely anti-inflammatory mechanisms. Now, one of the most complete medical reviews to date was published a couple years back. It's in the October 2007 issue of Alternative and Complementary Therapies and summarized in the July 2008 issue of the American Botanical Council publication Herb Clip. Even Dr. Andrew Weil wrote about this very topic just this week. Reviewing over 700 studies, the article from 2007 written by Dr. James Duke concluded that turmeric is better than many pharmaceuticals in its effects against many chronic debilitating diseases and does so with virtually no adverse side effects. Here are some of the diseases that turmeric has been found to help prevent or alleviate. Number 1, Alzheimer's disease. Dr. Duke found more than 50 studies on turmeric's effects in addressing Alzheimer's disease. The reports indicate that curcumin, the main extract and active ingredient of turmeric, contains a number of natural agents that block the formation of something called beta amyloid, which is a substance responsible for those plaque that slowly obstruct cerebral function in Alzheimer's disease. Those plaquey neural tangles that we talk about with Alzheimer's, this will help block the formation of those. Number 2, arthritis. Turmeric contains more than 24 anti-inflammatory compounds, including 6 different COX-2 inhibitors. Now, the COX-2 enzyme promotes pain, swelling, and inflammation. Inhibitors selectively block that enzyme. You may have heard of Celebrex, Vioxx, Bactrim. Those are no longer on the market. Celebrex still is, and there's still issues with it. These are COX-2 prescriptions. You know what? I can tell you that turmeric alone does a better job than those do at helping that pain. In fact, by itself, curcumin, again, that component in turmeric most often cited for its healthful effects, is a multifaceted anti-inflammatory agent. And studies of the efficacy of curcumin have demonstrated positive changes in arthritic symptoms. How about cancer? This is huge. Duke found that more than 200 citations for turmeric in cancer and more than 700 for curcumin in cancer. He noted that in the handbook Phytochemicals, Mechanisms of Action, curcumin or turmeric were effective in animal studies in the prevention and treatment of colon cancer, mammary cancer, prostate cancer, liver cancer, esophageal cancer, and oral cancer. This article said the effectiveness of curcumin against these cancers compared favorably with that reported for pharmaceutical drugs used for cancer. How do you get more turmeric in your diet? Well, one way is via turmeric tea. There's also a great curcumin supplement that I use in my office for many of my autoimmune and chronic metabolic patients. It's called co-curcumin. It's from Ayush Herbs. I give my patients at least 2,000 milligrams of curcumin, and most of them go up to 7,000, even up to 14,000 milligrams a day for certain situations. 7,400 is a pretty common dose that you'll see in my office. Now, the key with co-curcumin has to do with both the dosing and the ingredients. I used to use pills of curcumin, which are typically 300 to 500 milligrams a capsule. The problem is dosing. It would take literally 20 capsules a day to reach the dose of 1 tablespoon of the Ayush Herbs co-curcumin powder. The other problem is that most curcumins or turmeric extracts don't include the absorptive ingredients of a medium-chain fatty acid like coconut oil or even black pepper extract, which is used to help the curcumin get absorbed better in the body. So you can take 20 pills a day. It's not going to be used in the body like 1 little tablespoon of the co-curcumin. You know, and don't forget that eating more curry dishes, whether it's in restaurants or at home, can also help you get the extra turmeric your body needs. Even a local blogger that we see here in the Lake Norman, Charlotte area, talked about making a turmeric tea, and she actually bought turmeric root and made like almost like a Gatorade out of it with turmeric. And you know what? The key thing is it's going to help you. You're not going to take Advil. You're not going to do so many other things that you usually do medication-wise if you do this properly. However you do it, adding turmeric to your diet is one of the best moves toward optimal health you can make. Now, if you're interested in learning more, go to my blog, drakibagreenblog.com, and enjoy the reading. I've got this article and a lot of other great articles that are on there. More importantly, I encourage you to call and schedule either an in-office consult with me, Dr. Green, or a distance medicine consult with me to see if we can help you with your health problems, whether it relates to neurodegenerative diseases like Alzheimer's, painful problems like arthritis, or life-threatening conditions like cancer. We have treatment protocols that work for a wide range of chronic, metabolic, and neurological disorders. My office number is 704-987-3993. Our website is drakibagreen.com. Thank you.